So is there a possibility to keep the fertility while on TRT?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Yeah.
So 100% yes. You want to start?
Well, I think, we provided you with our labs. I think, we don't want to, because we're still now working with clinical trials and all that stuff. So we're not going to sort of disclose
We can't disclose exactly how we're doing it, but as you can see on the blood work, our total free T, DHC are skyrocketing, right. Yet our LH and FSH are normal.
So this came about, again, right? We were seeing younger and younger men with this problem, right? Low fertility, low testosterone, et cetera, et cetera. Michael himself is 36, so we're planning to have children, but obviously we had been on a TRT, so we were.
And I didn't want to get off. I was really so like, that's how impactful therapy was for me, that as soon as I felt within 3 weeks, when I started 6 years ago, it was so impactful for me, the results of how I felt, how I got erections. I was like, I can never get off. Yeah. So it started kind of like, wait, hold on.
That's a good point. So
to produce fertility, I got to get off. No, there has to be a way I can do this while on therapy.
So it actually started with, I don't know if you know who Dr. Ramasamy is. He's a University of Miami urologist who did an amazing clinical study on. So he basically took about 300 participants that had been on TRT without a testicular stimulant like clomiphene or HCG.
Basically, that's what we call testosterone replacement, when you completely turn off the HPTA axis.
Right. So these were men who were on TRT for over a decade without the use of a testicular stimulant like clomiphene or HCG. And so what he did was he took these patients off of testosterone and put them on a very specific clomiphene.
2,000 units of HCG 3 times a week, clomiphene 50 milligrams 3 times a week.
Right. And so the clinical trial was supposed to last 6 months. And surprisingly, within a 3-month span of time, I think it was
90 to 95% of the participants recover their fertility.
So
we give that to patients as a contrast. Hey, this is basically the risk you run of becoming infertile.
So through that, we knew that fertility could be regained, right? With a 95% chance of success, right? But the crux was that you had to get off TRT, right? So, which is not very comfortable for a lot of people, especially after you feel the difference. When you go from a 3 to a 10, you don't want to come back to 3.
Yeah.
Right.
Yeah.
So we started looking at the science of how the HPTA becomes, LH and FSH become suppressed. And one of the big ones is obviously
So when you take injectable testosterone, as we know, the half-life usually. So your body pulses about 6 to 12 milligrams, some say 7 to 13, let's just say 6 to 12 milligrams per day. So taking an injection, cypionate, usually even if propionate, having an elevation that doesn't pulsate is not really natural. Obviously, the more we can mimic the natural hormonal circadian rhythm by pulsing it the more natural rhythmic way, the better the results. So what I said in my head, okay, if we pulse on a daily basis, 6 to 12 milligrams at various times throughout the day, injectable form is not going to work. And obviously, as you saw in our blood work, the LH FSH was off. That's when we were doing 60 milligrams 3 times a week. Even doing 3 times a week, our levels are suppressed, because whenever you shoot the testosterone up and it stays elevated for 24 hours, sooner or later, you're going to have some LH and FSH suppression. We've seen it over and over and over. So what we did is started to pulse it on a daily form. Again, we don't want to disclose exactly with a specific delivery method that's not injectable, pulsing in a specific way, mimicking more that natural circadian rhythm. I think it's called Jatenzo. It's the new nasal spray that's been FDA approved, that if you pulse it 3 times a day, you don't have any HPTA shutdown. So I did this with another product it's compounded. And sure enough, as you see on the blood work, well, we did many blood works after that. We started doing that 3 months before taking that test. Sure enough, you see our LH and FSH level are back to normal. While our T, you can clearly see we're on therapy.
Yeah, our total testosterone, LabCorp doesn't read above 1500. So our total testosterone was above 1500.
We probably run around 17 to 1800 because we typically have a high sex hormone binding globulin, so our affinity is less than the average person. So we need to run a higher total T to get a higher free T in order for us to feel good.
Right. So free T was above, I think it was 30 to 40, and you see our LH and FSH markers are intact. In fact, above average, right? So it was like, whoa. Right. So when we saw this, we got all excited, and obviously our doctor was like, hey guys, don't get so excited, because the
litmus test is you need to get a sperm test.
Right.
So we're like, okay. And then you see on the blood work 2 to 3 weeks later, almost 3 weeks later, we get another LH and FSH test. As you see, his comes around the same. Mine came out a little higher. And our sperm test, from the motility, the morphology, the volume, it's actually above normal.
Yeah, above average. So the big,
you get a chance to look at the sperm tests?
Yeah, I have them in front of me.
Yeah.
The big implication.
So one of the things that I found funny is a lot of men are worried about their testicular aesthetic and their size. So, I know my testicles have shrunk about 20% because of the LH. Well, the LH, the amount of space it takes when they're shut down. Basically, I saw that not only the testicles, but the connection to the testicles, it was plump. And when I would ejaculate, I had a lot of volume. 6 years of being on TRT, the difference. And sure enough, I noticed that not only, if we prove this through research, and we can change the consensus worldwide, that if you take testosterone in a specific way, pulsating it in a specific way, you can get the benefits of testosterone and also keep your sperm count. I mean, that's an ultimate conundrum.
Yeah, that's a boon for specifically what we were talking about, right? So I think that the implications are great, because not only will it shift the narrative, right? That has basically been the medical consensus for as far as I can remember, right? That if you take testosterone, you're going to shut down your fertility. So number one, you're going to change that. Number two, this becomes specifically and especially important for, like I said, the younger generation that is now dealing with these endocrine disruptions that are causing the average testosterone rate in men to significantly be reduced, right?
Yeah.
So, like I said, if you're 28 years old and you have low testosterone and you're suffering from these syndromes, right? Yet you're concerned because you want to have the ability to have children in your future, now there is a way. So
once we're able to prove it on research, anecdotally, we've done it.
So again, the implications are great, because now you can reestablish, right, testosterone to a healthy level, which you are deserving of, right? Even if you're 28 or 30. And the biggest problem is, Steven, and I think you know this, right? So most people go to their doctor, insurance-based doctor, who are usually 9 out of 10 times really ignorant on specific hormone replacement, right?
No, not even that. The patient is not in control of their health. Not even the doctor. It's their insurance company that says yes or no, that gets to decide the value of my health. So that's why we can't rely on our traditional, we like to call sick care management system, because they're not really there to help you. They're here to monitor and maintain and manage whatever issue you're having as long as they can, because it's extremely profitable.
Right.
And as we know, you can't patent bioidentical hormones. You can't patent something that's natural. So obviously what we do for a living is something that they're not really interested in, because now you got a lot more competition and it's not patented.
Not only that, but it's the typical pattern, right? So, I always like to use the contrast. Look, you can be the best criminal attorney on planet Earth, but if I bring you a corporate civil case, you're going to be a fish out of water. So what happens 9 out of 10 times, here comes this young man, he's feeling the deep effects of low testosterone. He's suffering from probably ED like Michael did at 22. He doesn't know how to communicate it. He's telling his doctor, I feel like crap. The doctor runs a very anemic test.
CBC, CMP, lipid panels.
He tests for total testosterone. And now, because the reference ranges, as you know, they have been climbing, lower and lower and lower. If he falls within the normal range, right, 400, let's say, or 500, he's like, oh, it's not your testosterone. You're fine. It's all in your head. Here's this SSRI. But guess what? Normal does not mean optimal, right? And so you go to a PCP or you go to a doctor who's not a specialist at this, you only test for total testosterone, which is an irrelevant number, right? We know now that it's an irrelevant number unless you compare it and contrast it with the free T, right? Which is what's bioavailable, because 96% of your total testosterone is going to be binded up anyway. So if you don't go to a specialist, they go to a PCP, they tell them it's all in their head, and here's this kid. We've had many 22-year-olds.
Or worse, no, they'll prescribe them 1 injection a month.
Or 1 injection every 2 weeks, which violates just the simple pharmacodynamics of the medication, right? So this is what we're seeing, right? We're seeing that there's a lot of men that are suffering from this condition. They don't know where to turn. They usually go to a non-specialist who's ignorant about testosterone, and they either A, tell them it's all in their head, B, put them on a horrific protocol that will, end up with horrific side effects, right? Or just basically ignore their claims. Like we had a 21-year-old where he went to his endocrinologist, and his endocrinologist verbatim told this 21-year-old kid, he's like, hey, you're a good looking kid. You should have a girlfriend. Why don't you? This is all your head. Stop being a P. Stop being a P and get it together. An endocrinologist told him that, right? So think about the repercussions of that for a second, right? Here's a 21-year-old, feels like crap. Sexually, he feels like, what's going on? I'm 21. I'm supposed to be at the peak of my prime. I don't feel it. This endocrinologist, right? Because he's a doctor. And so, we have that, we've been indoctrinated that a doctor's word is like God's word, right? The ultimate authority. So this guy's telling me it's all in my head. I must be broken. I mean, think about the sort of, the psycho effects that's going to have on this kid. Right? I mean, he could have ended up calming and drowning his sorrows with alcohol or drugs, or and
a lot of times they do. It's unfortunate.
Yeah,
a lot of times they do.
So our message is simple, right? So our message is that.
Wait, no, one thing to add before you leave that message is we always like to go back to the Roman times and the Greek times. If you see the sculptures, they were built. They were naturally, their physiques look like they were producing 3,000 levels of testosterone. Yeah. And today, what do you see in the bodies? They're more morphed, they're more pear-shaped. Like human evolution is changing because of these EDCs, fat, circadian rhythm, stress. There's so many things bombarding us that we're evolving in a way that it just doesn't seem natural. And there's so many alternatives. Testosterone is not the only one. There's so many other things that, along with testosterone, if that's the issue, can totally change the person's life.
Yeah, and for us, it's about educating. One of our biggest things is education, right? Because you have to. If you don't know that these problems exist, then you don't think you need this stuff, right? Mm-hmm. But if I tell people all the time nowadays, I'm like, listen, man, if you're not willing to spend $3,000 to $5,000 a year on your health, you're in a lot of trouble. You're in a lot of trouble because, like I said, I mean, just from our food alone, we don't get enough, right? We just don't. So supplements are really important. And
pharmaceutical grade supplements, not just any type of supplements, because there's a lot of stuff out there that doesn't have what it says inside the bottle.
Yeah, we're pounding on the table for people to take their health seriously. And if they really are looking for a place that really takes longevity into perspective, right? Because it's not about getting a short-term result and looking great and feeling great, right? But can we sustain that long-term, right? Safely and effectively. And when we get into that, as you start educating people, right? As you start educating people and you start to feel the effects and you give it to them little by little. I mean, I think we're one of the few companies that when we send you some of the products, we send you a book along with it because we feel that if we never speak again, we want you to walk away with enough value and enough knowledge that nobody can take that away from you so that you can make the proper decisions in your daily life, right? Because let's face it, most people are not going to be proficient about this. Most people are not going to take the time to do the research because they got lives, they got work, they got all this stuff, so we do this for fun, right? We love the research, we love, and we practice it in our life. And I personally have read hundreds of books when it comes to fitness, nutrition, have tried everything under the book, eating 7 times a day, measuring my calories, grams of fat versus grams of, I've done it all, right? So our thing is, how do we make this work so that you can apply it to your life? Because you have to consider style too. I think that's where a lot of practitioners go wrong, where they use a one-size-fits-all sort of cookie-cutter protocol that you use this for everybody. But you can't, because not only do you have to consider the pharmacokinetics as we spoke, but also the style of the person, right? If this is not their style, you can't just pump them up with a bunch of stuff because they're going to be overwhelmed and they're going to quit. Yeah. So you have to really pay attention to the person's, not only their goals, which are important, and for you to take them there effectively and safely, but also to listen to their style. So you know what to give them at what time and how much, right? Because we don't want to overwhelm them, right? So what we realize is that when we take that slow approach and we start with the fundamentals, people are like, okay, what's next? What's next? And as they become educated, they become more willing participants in their own rescue. Right?
No, and we have an educational system in place because we think it's very important for the client to become autonomous, as if to take charge of their health. Because today we depend on so much things that don't work, and then they go online, they read that fat is good, fat is bad, testosterone is good. Which one is it? So we found that if you're gonna take this path, since we already know we're swimming against current, it is our responsibility to educate the patient, because although he might be pumped and motivated and he starts doing it, all of a sudden he hears some nutrition guru or some influential person in his life that says, oh, you're doing that stuff, what are you doing? Get off of that. That's going to produce prostate cancer. Usually that's the thing you hear the most. Then a lot of people will stop because they were influenced by that one thing that they heard from that one person without having enough fundamental evidence to understand, wait, hold on, there's so much more to this picture. So we found that it's extremely important to educate the patient with a newsletter once a week on specific information about their lifestyle, hormone, dietary habits, in order to equip them with the tools that they need. Because that's the other thing we find. Some people come to us with the expectation of looking like Mr. Olympia or something like that, which, by the way, whenever somebody comes in with that mentality, bodybuilding, hey, look, there's many other clinics out there that will cater to that. We don't cater to that. Yeah. We cater to lifestyle. We cater to people that come literally broken and are like ready to change, because that's the clientele we like to work with. Why? Because you're already putting in half the work. We need you to meet us halfway in order for us to deliver on our promise. Yeah. Otherwise, if we don't have a committed patient, if we don't have a compliant patient, how am I supposed to give you results? And then you end up complaining, saying that what we offer doesn't work because you weren't compliant.
Yeah, I think that because of culture too, right? So our culture is immediate gratification, right? So they think, I always tell people, I'm like, listen, it took you 35 years to get to the state where you're at. Don't expect us to undo it in 2 weeks.
Yeah, cancer doesn't just happen like that. It's a suppression of your immune system for years.
I don't have a magic, wand that I could definitely, help you get to the place that you want to be. But hey, listen, I'm going to give you some tools, but you need to use the tools, right? You need to do the heavy lifting. Like if you're a professional athlete and you had these things, you're not going to stop training, eating right, and sleeping right. If anything, you're going to push harder, right? Because these things will help you, right? So I think that for a long time, we've put our health in the hands of, an outdated traditional model. And it's kind of like leaving your wealth in the hands of a stockbroker, right? His interests are totally different than yours. So, we're kind of pounding on the table to have people, really take their health seriously, right? And I think that the pandemic was also a big wake-up call.
A big wake-up call, for sure.
A big wake-up call as to, the level of health that we have. COVID is correlated, the deaths in COVID are correlated to, low immune function, right? So, and
that's where peptides also come in, like thymus and alpha-1. We saw the power of what that can do to boost somebody's immune system and, see them recover in miraculous ways. Yeah. So we can't make any statements on that, but there's many other routes like peptides as well that are very, very powerful when used in specific conditions and cases.
Yeah,
that can work.
Yeah, we're also, that's an interesting point, because we find that a lot of places, they use these things like blankets, right? They're like, oh yeah, take this, it'll make you lose fat and build muscle. is so much more than that, right? So peptides are about cellular efficiency. They're about reducing cellular senescence. Most practitioners don't even know what that means. So, you know, for us, there's necessities and there's luxuries, right? And both of them are nice to have, but you always have to take care of your deficiencies and your needs. And that's where we're very big on testing. Let's take care of your deficiency needs. Let's cover those. Let's get you comfortable there. Let's get you some really solid results with the fundamentals. And then once we have a foundation, once we've prepared the ground, now we can build on top of that. And, you know, that's where peptides come in, but peptides have to be very strategically used, very purposely driven, right? You have to know
now you'll desensitize the response of the medication used properly.
You have to know the person's goals. You have to have those very clear in mind, and you have to really set the expectation. Like, look, these things will work if you do these very specific things, and we will coach you through it so that you have the best results, right?
Right. The typical, let me take a pill and look incredible. A lot of people want the easy fix. And we notice that when you have the mentality, hey, let's start with the basics. Once you get results and now you're pumped and you're motivated and you're willing to put all these other factors in place, then now we can talk about getting into this specific area, which is more for people who are advanced and who are dedicated and motivated and committed to their health, you know,
and their life journey. You know, becomes so much more fulfilling, right? So like, you know, for us, I think that the most fulfilling thing is those stories that we get, right? Like, kid was working at an attorney firm, and he finally grew the courage to quit that firm and start his own firm. You know, a guy who's in his 40s, you know, one of his biggest bucket list items was to be a stand-up comedian, and he never had the courage to do it. You know, 6 weeks into therapy, he's on stage.
Or worse, my favorite is they're about to get a divorce because they haven't had sex in 5 years. They don't even sleep on the same bed, and they grow into like friends, and all of a sudden the love and the passion for that relationship gets lost. And all of a sudden we get them on therapy, and the wife within 6 months is on therapy with us because can't keep up with the husband. You know, that one is
so it's kind of like when you work with somebody, I think, you know, this is my message for anybody watching, like if you're curious about this or you want to start this, you really have to align yourself with a company or people that have a similar philosophy, right? So ours is longevity and health, right? Because look, if you make $1 million, great, but if you can't keep it, what good did it do, right? So it's about reaching a great state of health and then keeping that long term, right? So that, you know, and it's also about learning about the individual, learning his specific goals, because you know, I want to make the correlation that one of the cardinal rules that I think a lot of practitioners make is that they get married to lab tests, right? They see the numbers and they get married to that. Right. And I think that's where
they start treating the numbers rather than the individual. That's
where our Dr. Rudolph, everyone was a beautiful doctor, because he really is excellent at listening to the patient. Because look, him and I have very similar biochemistries, right? But we have totally different symptoms, right? And so he uses the lab as a really good guiding post, right? It's a really good map, right? To take you where you want to go. But it's also about listening to the specific symptoms, right? What's going on? What are you dealing with? Because low testosterone can show up in many different ways. People think that it's, if I don't have sexual libido and I don't have good erections, that was never my problem. That was the way that it manifested in him. But for me, it was mental fog, lack of energy, lack of motivation, right? And when we talk about these things, everybody has different motivations. Everybody has different goals, right? So for us, it's about how do we use these things in a therapeutic way so that we can maximize and that we can enhance the quality of life in all the areas that are important to you, Mr. Smith, or to you, Mrs. Smith, because everybody's goals and everybody's values are very different, and you have to pay attention to what's important to them so that you can help them achieve that.
And I think one thing that's very important, that I think that's one of our core values and why we've done so well, and we hope that other clinics encourage this and follow this, is that everybody in our practice is on therapy, from both doctors to the wellness specialists who coordinate the patient's treatment, to even our administrative staff. We believe in people who believe in this. We don't want a guy on the phone trying to sell stuff. We want somebody that's been changed by this and can know when to say no to a patient, because that's the unfortunate thing. A lot of times they're just, oh yeah, you want this? It's almost like a kid in a candy shop. They'll sell them everything, and then they get side effects and overwhelmed, and then they give our business a bad name.
No, so forget about the business with a bad name.
When I mean the business, the hormone business, they give it a bad name because they're focused on selling something rather than focusing on really taking the patient step by step. And another thing that what we realized, for example, we have Dr. Rudolph Eberwein, who's the male doctor for the male patients, and the male patient has a male coordinator. And then we have a female doctor, Dr. Amy Wecker, which she's phenomenal because she's not only an avid about hormone replacement therapy, she's also a yoga instructor. She lives the whole entire life, and really takes the time to see the patient's lifestyle, their dietary habits, their spiritual lives, their intimate life, like goes deep into things that typically doctors don't do anymore. And that used to be back in the days. And the reason why we had it separated, like there's a female doctor with a female coordinator, is because although a female doctor might be able to understand what low testosterone is, she will never be able to relate to a flaccid penis. It's just not going to happen.
Or she won't know what the difference is between having 100 milligrams in your of testosterone in your body versus 200 to 300 milligrams of testosterone in your body. She's never going to be able to know. Not that she won't be effective or that she's not smart enough or not capable. It's none of that. It's just she can't relate to a semi-hard erection anymore that I'll be able to relate to sore boobs
or vaginal dryness. Like we don't understand that. So we found that relativity and being able to relate to the patient and connect with them is very important. So they feel that, oh, I'm not alone. Like this is more normal than what I thought today. Yeah. So the patient feels empowered and encouraged to really make a change. And that's the other thing that we found, that unfortunately what we do, meaning us, including you, this business is fantastic. The problem is that it's also how you deliver the service and the product. A lot of places are delivering in a way that it's not sustainable, that there's not a good follow-up this system. There's not a good documentation system where when the patient comes to their follow-up, they're kind of lost in the air. And
financially, it's an important part, right? Yeah. Especially during these times. I mean, we've had a really economic turmoil, right? And so if you're focused on the sale, right, there's no sustainability to that, because our goal is, hey, listen, we're going to do all this. We're going to reestablish your biochemistry. And then let's talk about what is the bare bone minimum. So if S hits the fan and you really just have to focus on the fundamentals, this is what it's going to take. And so we try to work with the patient so that this doesn't become financially crippling, and so that it doesn't become something just for the elite. Now, if you want to be part of the elite and you want to take it to the
next level, we have a VIP program for that.
We have, we could go as far and as deep as you want to take it, right? But, there's the other spectrum, right? There's the guys that really need this in their life. I mean, they got 4 kids and they're working 9 to 5 and they feel like they're dragging. And, by the time they get home, when their real job starts, being a husband and, being a father to their kids is they're at their wit's end. Right. So how do you help those people and not making it financially crippling for them as well? Right. So I think that's where it's important. And that goes back to philosophy. Philosophy is very important, and aligning yourself with a company that takes your best interest in mind and your longevity into focus is very important, because if not, it becomes that problem, right? It becomes a sale problem. It becomes, oh, what can I get right now from this? And, hey, you're going to do this therapy. Great. And can I maintain it?
No. And we like to tell patients also that, when you pay out of pocket, because this is an out-of-pocket service, it is our medical duty to deliver on that promise, because it doesn't make common sense for you to do something, get side effects, and continue doing it. So we have to make sure that this is done in a way that it's not a okay change, that it's like, whoa, my life has changed. I went from having 0 erections to waking up every day with an erection. My wife, we're having the wildest sex. My kids are extremely happy because they see a connection between the husband and wife. I'm thriving in my business. I'm feeling like $1,000,000 and they're smiling ear to ear. That is the ultimate spiritual fulfillment we get from helping others in this thing, you know, and that's why we wanted to talk about that, because it's important to encourage that if people are going to do this, that there's a sustainable system to approach it from a place that they can deliver on that promise, you know?
Yeah.
So, and I think that maybe later on, bringing Dr. Rudolph Everwine, which is one of our business partners, the doctor as well, he started with writing a book about low testosterone, which that led to endocrine disrupting chemicals, and that led to a whole other window, which is like obesity, diabetes, infertility, metabolic disorders, depression. It just happens to be that testosterone is the one that's shunned. But there's so many other areas that are being affected. And I think he has a lot to bring to the table when it comes to understanding that what's going on today is not only an epidemic, it's more normal than people understand. And it's all right for you to reach out and get help. It's not all right for you to be losing your hair, having erectile dysfunction, feeling depressed in your early 20s, early 30s, or even early 40s, you know? And that's one of the things that he studied, is that back in the days, it was a midlife crisis type of thing, 50 and older. Now, then it became like 40-year-old situation. Now it's become a 30-year-old situation. And now we're seeing a 20-year-old situation,
where they go through sort of like existential crisis. Because, and then when you test their levels, you're like, oh, of course, right? You know, I think also the work of Mark Gordon, he's a neuroendocrinologist, specializes in TBI.
Do you know who he is? Mark Gordon?
And his
yeah, he has been on the channel. Danny Bossa interviewed him.
That book is this.
TBI,
we love him. We're becoming a millennial provider, which is going through his training. We believe in his training and
it's funny because his work is in TBI, and so a lot of people are like, oh, I don't have a TBI, it doesn't relate to me. But he discovered the relationship of the hormone cascading effect on the brain, right?
Quiet Explosion. Have you watched the documentary Quiet Explosion with him?
No.
Oh, you need to watch it. Quiet Explosion.
Okay.
It is phenomenal documentary.
So what's that?
So yeah, you know, it's to kind of wrap it up, I think. And, you know, if you want to have Dr. Everyone on the show, that would be a great pleasure. He's really excited about it. And just to kind of hear.
And Dr. Everyone, she's another.
To hear from practitioners that really have a different mind frame when it comes to this, right? They don't look at patients as numbers. They listen to them. You know, for example, our Dr. Amy Wecker, her consultations are an hour long.
Or an hour and a half sometimes.
I mean, think about that. You're in the room with a doctor for an hour and she's getting into everything. Sometimes it's just weird. I don't even like to read her notes because it's way too much, right? So yeah, it's just, it takes a different approach, right? Because you need, especially nowadays, we need the help. We need actual health care, and we don't have health care. We just have a machine that pumps up drugs to calm symptoms, and eventually those, you know, there's an end to the rope of that, right? It stops working. SSRI stopped working, right?
We're seeing the breakthrough with psychedelics right now, mushrooms and ketamine therapy, how one session people are having profound breakthroughs and regaining their life back. That's, you know, this is a breakthrough in science. I think we're going through that shift right now. It's pretty powerful.
Well, guys, it was a fantastic message you brought here. Thank you so much.
Sorry, we're long-winded.
Yeah, well, very interesting to listen to. Tell me, and the viewers, if they want to reach out to you, how can they do that?
Yeah, you can go to, actually, we encourage you to go to medicalhealthinstitute.com, check us out. If you want to Google us, Google our reviews, and there's a phone number there you can call. And rest assured, like Michael said, you know, one of the beautiful things about our company is that we don't have sales guys on the phone. Yeah. We have guys that live, eat, breathe this stuff. You know, you might catch me, you might catch him. So anybody who picks up the phone is going to be able to help you, listen to you. You know, we've been trained, and we've trained our people to create an environment of safety where, you know, if you have erectile dysfunction, for example, that's a difficult thing to talk about as a man, because virility is it's second nature to us. So, you know, to talk to another man about it, it's kind of like you're losing your power, right? So, you know, our guys know this issue very well.
Especially for me, and we communicated on a weekly virtual meeting that we have as a team. And I made sure to integrate that, hey, take care of this subject seriously, because I know what it is to suffer from that.
Half of them have been through it. So, we created an environment of safety where you can really communicate what you're going through. We listen to your individual needs, your individual goals, and we try to get you to the place where you need to be.